hours just for a consultation. That's
Well, I was just saying, you know, well, Life at the North, that's what it is. So, like, right? The specialists are here.
wow. And it shouldn't be like that because
No, it shouldn't be.
this procedure is relatively simple.
Yes.
And how many times, now that the camera's on, how many times have you had these toenails removed?
3.
3 times. One was actually under general anesthetic.
Yeah, so the one was like he froze me, but like I watched, and it was like he was not at all. He just looked so rough doing it. Like I had to look away because I thought if he slips with that scalpel, like I'm not gonna feel it. But like
He was using a scalpel.
he was like like this.
Sawing. Oh. And you said the injection was not fun either.
No.
Very
No, this
different.
was like, I mean, it hurt, but not that bad.
Not even the same, huh?
But then I've had it done so many times.
Now this is the big thing that, you know, this has happened. Your nail has changed and become deformed and split because of the trauma from the actual removals.
Right.
They tried to kill the nail bed, didn't work. That's why we have some regrowth happening and the nails, you know, growing in pieces, thick and thin. This can also happen, this exact same look, for people who've dropped something on their toes.
Yeah, so the very first injury I had with my toe was in high school.
Mm.
I dropped something on my toe.
Wow.
And
Yeah.
it should have been removed, but wasn't. So there was all that pressure.
And that's what, you know, probably made the whole toe worse as well with time, making it more difficult. And today, it is a little bit trickier because it's not one big piece that we remove. I have to make sure that every little spike is gone. So we'll make sure we have a scalpel and a blade out just to make sure I open. Sometimes, like, it's really interesting. The body forms like little capsules underneath that trap each little individual spike in its own little section. So we'll make sure everything's open, flood the area with the acid, and take care of this thing. Because it's amazing, like you said, came for the consult. It's that simple that we're going to do this procedure now, so that way you get it all done in one trip.
Yeah, that's fantastic.
Of course, I'm happy we could do that. We're going to just do one quick little check to make sure the toe's completely numb, because that's really the most important part. Once we know you're numb, then you're pretty easy. So, little toothpick, I'm going to touch the top of your foot so you can feel sharp.
Yeah.
You feel that there, right? Pressure's normal, but you shouldn't feel anything sharp.
Oh, I do feel pressure, yeah.
Okay, but nothing sharp?
No.
Here?
No.
Nothing sharp.
No, that's cool. I feel it there.
Feel the difference there, right? This is
Yeah.
sharp. Anything here?
No.
Awesome. So what we're putting on is a little tourniquet, and this is to make sure there's no bleeding.
Oh,
Yes, because I'll tell you something. Well, number one, if there's too much blood, you can't see what you're doing.
yeah.
And number two, the acid that we're using, if there's too much blood, it will actually become diluted and won't work
Well, and that's probably what happened because I did bleed quite a bit when you...
while they're removing it
See,
up.
none of this was done. None of this was done. This is very interesting.
Yeah, it sucks to hear. That's why, you know, I love doing this procedure because it's very simple, very quick, and effective if done right. So I'm going to do one last little check. I will cover for a second. Anything sharp here?
No,
Anything here?
no,
And how about down here?
no, good.
Awesome. So we are separating that nail,
Okay.
the nail bed. I'm going to be very curious to see if this is actually one piece, and it looks like one big piece. But the piece that's here is very different.
Mm.
So hopefully you got all your family's gonna be watching this video. They're gonna see what the heck you've been dealing with.
Look at that.
Yeah, it's actually one piece still. We got very lucky. Makes it much. Easier.
Look at that.
There it is. So they didn't kill basically anything. They just basically destroyed the nail. And that's why it looked like it's growing in these two spikes, but it's all one piece.
Oh, so they just messed it up. Did they? Sorry.
That's
I'm
one
trying
way.
to be polite.
They just missed a few pieces. Yeah, that is the nail gone.
Wow.
Very different, isn't it?
Yeah.
So like we discussed, I am just going to use scalpel just to clean up underneath, make sure there's no little scar tissue that can sometimes form after a couple removals, so the acid really gets where it needs to go. This is a little trick I have to learn today. Sometimes the cuticle doesn't open up and you can't put the Q-tip deep because the scar tissue kind of closes it up. So I'm just lightly opening it up a little bit. You see there?
Mm-hmm.
So you see now I can go further and further back like it normally is done.
See, I have no stress watching that. Like it looks very, it's not harsh looking, like to look at.
Not intimidating, not scary, right?
That's right.
Very controlled. See now further I can go back in here.
Right.
So sometimes the scar tissue closes it up and you get like a stumpy nail. And that's why the middle section wasn't really growing as well, because yes, there was some damage to the nail bed in the middle, but not enough to actually stop it from growing.
Okay.
So this is pretty much what closed shut, and that's what your toenail is going to look like. Or your toe's going to look like, not your toenail. There's no more toenail. And so this is the acid, phenol, that we're using to stop the nail from ever coming back.
Yeah, he put way too much on.
Did he just pour it in?
Oh yeah.
He's trying to give it an acid bath. That's can be dangerous. So you were watching when he was doing it?
Yeah.
And there's a lot of blood.
Yeah. I would suggest anybody to come here.
Oh, that's very sweet of you.
No, this has like actually been a pleasant experience. If I could actually say that about a toenail removal.
Well, it's been a pleasure for me ripping out your toenail. We got if you want more, we got some more nails if you want in the future.
No, that's okay.
There's enough to go around.
Yeah, I think two's good enough.
Okay.
Wow.
This is how we apply the acid. So it has to be more controlled.
Definitely.
3 removals though, that's a lot. And I'm sure, I'm not gonna, hopefully I don't jinx it, but the healing when we do it in a more controlled manner is usually better.
Yeah.
Because we're creating less trauma versus when we're very rough and ripping tissue, and
Yeah.
you probably had a huge chemical burn.
Oh yeah. Obviously, because like, yeah, no, there was like, it was on my skin.
Well, look how
looks pretty
deep
good under there too.
it does, but look how deep that is.
Yeah.
I'm really happy the nail came out in one nice piece because that makes it way easier. We'll get another. I'm good for this. This is the last one. Yeah, I like doing this one because once we know the toe's numb well, we don't have to rush it. Take our time. You're actually watching. I'm impressed.
Well, I can't believe. Like I'm in awe, really. Because I had to look away when I had it done the last time. It was kind of a traumatic experience, actually.
Well, hopefully we're bringing it back so you ended on a good note.
Yeah.
And so what we do after this is we actually then just put a little bit of rubbing alcohol, and this actually neutralizes the acid to stop that reaction.
Okay.
Because if you don't, sometimes you can get more of a chemical burn afterwards.
Yep.
Did they do any sort of neutralizing the acid after last time? You just poured it on and that's it?
Yeah.
So you can see what happens. It really damages the nail.
Yeah.
Okay, so here's that little bit of the rubbing alcohol. That's good. Just gonna dry it out. And that's it.
That's it, eh?
That is it. So this is how you're gonna take care of it. Antibiotic cream.
Okay.
More the better if we're using gauze, because if you don't put enough cream, the gauze will stick.
Yes. So
So
can I use the non-stick gauze?
you can. The only issue is it doesn't absorb blood very well. So if it's bleeding, which it could bleed usually the first or second day,
Oh, okay.
it gets all over the place. So I would say is you put on more cream,
Yeah.
and you're just going to be changing this bandage morning and night.
Okay.
You're gonna do a little bit more often the changes, so that way it keeps everything fresh.
Yeah.
And the gauze won't stick to your toe.
Okay, good. Because that actually happened to my daughter the first time she had it done. Yeah.
How long did they tell her to leave the dressing on?
I don't remember, but we had to bring her into nurse to get the gauze
Oh no,
ripped off.
that's not fun.
Yeah.
Okay, that was it. That was the whole thing.
Fantastic.
So like I said, we will leave this gauze and everything on till later tonight. When you get home,
Yeah.
you can take everything off. Then you put on new cream,
Yeah.
gauze, and wrap.
Okay.
Now, if you want to shower, you can definitely shower tomorrow morning.
Yeah.
Shower with this dressing on.
Okay.
Then you take everything off, dry the toe, put a new dressing on top.
Okay.
Okay, great. One down.
One down.
One more to go. No pain?
No.
So we're going to do the exact same thing. So what's crazy is no matter how thick, how damaged, how destroyed the nail is, it's the same procedure every time. The mechanics, the basics of the nail is always the same. So we get people come from all over the same store with ingrowns that have been removed multiple times. And it's just, you have to make sure every little step of that procedure is done like this, and you will not have a problem. So we're gonna do that last check, and the other Q-tips are up, you can pull them up. So just so you're not looking, anything sharp here?
No.
Anything here?
No.
Down here?
No.
And how about down here?
Good.
Okay. So here, we can see that the cuticle is very different. It's very tight. It's almost like fused. So, and it's the same thing there. In the middle, the nail got more damage than the side, and that's why there is nail here. It's just not that thick.
Okay.
So you can see I'm actually underneath that thin piece.
Yeah.
So you still have one complete nail, but it's growing in different layers. It's very interesting. So there's one side, there's the other side, and there's the middle, very thin.
Yeah, it's almost like paper thin.
It is paper thin. Yeah, you can see that. It is connected. Very interesting. So seeing how everything, look how much cleaner it looks already, huh?
Yeah.
So I'm just going to make sure underneath that there's some space so that acid can really get into the middle where that nail was a little bit thinner and the nail and the bed and the cuticle were a little bit tighter. So see, this is how far I can push my tool.
Oh.
Not very far. You see how I can go further back here?
Yeah.
And here? And this is, again, my little trick. Open it up, get the acid all the way in there to make sure nothing comes back. And you learn that the hard way. Trial and error. Okay. And nothing's hurting?
No, that's good. Well, and it's a good time to get this done too. I don't work till Wednesday.
That's awesome. That's great. So you get enough rest. See now how I can actually go underneath now?
Yeah.
That's what we want. And the cream can, so the acid can get all in there. Nothing's hurting?
No.
Okay. And you're not going to be shy. You can tell me.
Oh no, I tell you.
Okay. Yeah, we were worried about all the snow yesterday and today, and this is nothing for you, huh?
No.
Oh my gosh, we're babies down here.
Well, you know, it's just what you get used to. I will say though, when we were on the 401, there was a period of time where the blowing snow was
Yeah.
uncomfortable. But then we're not used to driving on the 401 either.
What's this? You guys just take it easy when you guys are driving?
Yeah.
Here, do you find us that we drive fast?
Oh, yeah. But my daughter is with us, and she's from Edmonton, so like she drives fast.
They do, because their speed limits are like 110, 120.
Yeah,
Yeah.
yeah. So it's nothing for her.
So does she think we drive slow then?
Yeah, probably.
Oh my gosh. Well, she is very good to be driving you, and I still can't believe you're going to come. Did they offer you a virtual consultation? Or you wanted to come in?
Yeah, I did want to come in.
Okay.
Yeah.
Yeah, I've been doing virtual consultations for people all over North America.
Oh, yeah.
And unfortunately, a lot of them can't come in, especially with what's going on now.
Yeah, I don't know. I think it's just you get that personal. I mean, I know you got to be careful with COVID and stuff like that, but sometimes, like things like this, you kind of have to see it, I think.
Yep. But again, I see it all the time on these virtual consults, and unfortunately, they can't come in. So I'm really happy you came in. We do it all in the first go. Mm-hmm. And it didn't really take that long.
No.
Yeah, we're already finishing up on this one. So you can see how the Q-tip goes under nice and deep?
Yeah.
And then we're going to make sure the ash gets everywhere where it needs to go. I cannot believe they poured it in. Oh my gosh, this stuff is strong.
Yeah.
Did you get a big blister? Or was it just red?
Oh, it was red and blistery, and
Oh.
yeah, I got an infection, and it was horrible.
Oh, sorry to hear. That's no fun.
Yeah. But it's people need to know what they're doing, and sometimes, as well, I wouldn't say. Well, I guess I am a consumer. Sometimes you need to pay a little bit more attention to maybe who should be doing stuff with you.
Yeah, and sometimes I feel, it's our job, and that's why I started filming all these procedures, was to teach people what foot specialists can do, because a lot of people don't know, right? And a lot of doctors don't know sometimes what exactly I do, so it's really important that they learn by seeing all the different procedures, so when they do have a condition, they can say, hey, let me send you to a foot specialist near me.
Yeah.
Did you ever think to go to where your daughter had hers done?
So my daughter had hers done in high school for the very first time, and so she just had it done by a surgeon in Emerge in our local hospital.
Mm-hmm.
It went relatively well, but he would not take it right out. Like, he wouldn't destroy the nail bed because he had the idea that
It'll grow back better.
Well, no, he just had the idea, well, you're 15, 16 years old, you're not going to be able to wear open-toe shoes. And she said, well, why not? She says, what's the difference if I have ugly toes that hurt or ugly toes that don't hurt? So she had already made up her mind at that young age, but he would not remove the nail bed. She does have one piece left on the one toe.
A little bit of a regrowth?
Yeah, but very...
Does it bug her?
What's that?
Does it bother her?
Yeah, it does.
Oh my God, we should have brought her up and do that little thing too for her.
Yeah.
So there's that little Fucin cream.
Okay.
Well, she doesn't have to come this far in the future. There are foot specialists in Sudbury
Okay.
that definitely could do that procedure.
All right.
That are foot specialists just like me.
Okay.
So-
She, like I said, she did have it done in Sudbury, but there's just one little piece of regrowth.
Yeah, she could always go back to the place and they should be able to fix it.
Okay.
Yeah, unfortunately you have to go through the procedure again, but sometimes it does happen. But the fact that they'll see the piece that's there,
Yeah.
it can be taken care of. So the fact that it's bothering her, get her to think about maybe going in
Yeah.
and getting it done again. Just so then she can be over with it for once and for all.
Yeah.
So, that was it. That was our fun together.
Yeah, that was awesome. Thank you.
You are definitely welcome. Really happy we got it all done today.
Yeah, me too.
You're gonna have 2 little take-home packages
Okay.
with some gauze wrap,
Great. Thank you.
Band-Aids, some of that iodine. The only thing you have to get yourself is the antibiotic cream.
Antibiotic cream. So like a poly.
It's called Fucin. It's a prescription.